Hi, my name is Robert Ebersole. Good morning, teachers. Today I will instruct you on some life-saving techniques that can be used inside as well as outside of your classroom. I will be instructing you today on the use of CPR, the Heimlich maneuver, and the use of an EpiPen auto-injector. Each of these techniques can be used on children as well as adults with some pretty positive results. You can possibly save the lives of your students, family members, or even a complete stranger. We are going to cover the techniques that you will able to easily remember, and I will lay them out and demonstrate the use of the correct techniques. You do not have to go to school to become familiar with the application of these techniques, though higher education and certifications are available. Many people often do not help others in emergency situations because they have fears of repercussions from their actions. If the techniques explained today are used in the correct manner, you are covered under the Good Samaritan clause of the law, CPR. First, we will discuss cardiopulmonary resuscitation, CPR. CPR is used for unconscious persons that are unconscious due to injury and or medical problem. First, you want to check the scene for your safety. Send all your students into the hallway, which clears them away from you and your student. And have one of the students go to the office and ask for help. Have the office dial 911. If the child is unresponsive, you want to lay them flat on their back on a firm surface. Use the look, listen, and feel technique. You will be looking for the rise and the fall in the chest from breathing. You will be listening for breath sounds, and you will be feeling for a pulse. If you do not see these signs, you will begin CPR. You want to administer 30 chest compressions to the student. This is done by placing one hand over the top of the other, interlocking your fingers, and compressing about 1.5 inches for children and 2 inches on an adult directly into the center of the chest, avoiding the xiphoid process. You want to compress at about 100 to 120 times per minute. At the end of the 30 compressions, you will give 2 rescue breaths to the student. It'll begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. You want to deliver 2 rescue breaths, and in order to do this, you want to do the head tilt, chin lift technique. You want to push down on the forehead, up on the chin, opening the airway. You want to pinch off the nose, give 2 breaths, giving time between each breath for him to exhaust both breaths. You want to continue CPR in the 30 compressions and 2 breath cycles. You will continue the 30 to 2 until the student starts to breathe on his or her own. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 3, 4, 25, 26, 27, 28, 29, 30. Again, head tilt, chin lift, open the airway, 2 rescue breaths. Until your student comes back to life. You are to continue doing the 30 to 2 cycle compressions until medical personnel arrive and takes over emergency aid, or if you become exhausted from your efforts and you can't continue. Next, I want to instruct you on the Heimlich maneuver for a choking victim. The Heimlich maneuver is a simple one-person technique used to unblock a choking person's airway. The technique will probably be used by most teachers in a classroom setting during their careers, especially teachers of younger children. If you suspect a child is choking, you can only have seconds to react to get the child breathing again in the classroom setting. There are many small items that children can put in their mouths that will cause them to choke. The Heimlich maneuver is a simple but effective way to clear a person's airway. There will be signs and symptoms of a person who is choking. They may appear as trouble breathing, an ineffective cough, wheezing, or the universal sign of grabbing their throats as they cannot breathe. First, you want to send a student to the office for assistance. Have the office dial 911. Clear the remaining children into the hallway where you have room to administer aid to your student. Give 5 back blows to the upper part, center part of the back. Lean them over. 1, 2, 3, 4, 5. And if it hasn't come unlodged, you then want to get behind the standing or the sitting student, wrap your arms around the abdomen, make a fist with one hand, clasp that hand with the other hand, place the thumb side of the fist toward the rib cage about 2 inches above the belly button, and sharply and quickly give 5 thrusts inward and outward. Repeat the process until the object comes out or until the student becomes unconscious. 1, 2, 3, 4, 5. And again, 1, 2, 3, 4, 5. Spit out. Okay, if the student becomes unconscious, lay him and her flat on a firm surface and begin CPR immediately. The EpiPen auto-injector. The third life-saving technique that I would like to discuss is the use of an EpiPen auto-injector. It is used in case of an emergency reaction, allergic reaction. The EpiPen is usually kept in the school's office. Recognizing the symptoms of an allergic reaction and administering an EpiPen as quickly as possible is crucial for the well-being of your student. The signs of an allergic reaction may present as swelling of the lips, tongue, or throat, hives, a rash, breathing difficulties, nausea, and or vomiting. First, you want to send students to the office, advising them that you need an EpiPen for an emergency. Also have the office dial 911. Have your students step into the hallway to give you room to administer aid. When the EpiPen arrives from the office, you want to remove the EpiPen from its carrier and remove the blue safety cap. Hold the EpiPen in your hand with the orange tip facing downward and the blue tip upward. You want to lay the student flat on the ground, flat on his back. Kneel beside them and position the EpiPen into the center of the thigh, the big muscle of the thigh, and firmly push until you hear it click. Then you want to count to 3, counting 1, 2, 3, and remove it. You want to sit the student up, and you should start to see an immediate relief from the allergic reaction if the EpiPen works. The EpiPen can be injected through clothes as well as open skin. Place the used EpiPen back in its carrier. Give it to emergency medical personnel when they arrive. The correct dosage of an EpiPen auto-injector is 0.15 milligrams for a child and 0.3 milligrams for an adult. In all the above situations, a follow-up from emergency medical personnel should be used. Emergency medical personnel will be able to treat any further complications for which they are trained. By quickly acting on what you see and what you are able to do, you can keep your students alive as most of emergency situations. If you do your best, you can protect your students, family members, or even strangers from a simple but fatal encounter.